When COVID-19 first erupted in China, infectious disease experts at U.S. hospitals took notice. In the U.S., the focus is on preparing healthcare workers.
We're updating the skills and knowledge to the caregivers. That includes how to put on personal protective equipment and how to take off personal protective equipment so that you're not contaminating yourself.
Some hospitals have specialized rooms to treat patients with highly infectious diseases. But can any hospital really prepare for COVID-19?
That's a very difficult question to answer because it really depends on the demand. If there's a few patients, sure. If there's a gazillion patients, there's not a hospital in the world that's ready for that.
Hospitals in many countries are encouraging doctors and patients to visit by Skype or by phone.
This is an excellent solution to both normal influenza season as well as instances like COVID-19. Patients can get quickly evaluated, get their questions answered, and we can get the sick patients that need to be in a hospital to a hospital, and we can keep the patients who don't need to be in a hospital safe.
Other ideas include testing outside the hospital in tents or even while people stay in their cars.
80-85% of patients don't need to be hospitalized, can stay at home. So for those patients, that would be a very good idea to be able to test them but then divert them from actually having to come into the hospital.
The CDC plans to allow hospitals to do their own testing, which will cut the turnaround time for test results from days to hours. One of the biggest concerns is preventing the spread of the virus to staff or other patients in the emergency room.
Preventing the spread of this virus within any organization is going to be a challenge. It's going to be, in the absence of a vaccine or in the absence of a treatment, it's going to be old school infection prevention.
In the end, it's down to controlling germs. Carol Pearson, VOA News, Washington.